Welcome to our channel. Today, we're diving into the fascinating world of Shilajit, a traditional herbal medicine that has captured the attention of health enthusiasts. Let's explore its benefits, potential side effects, and how it can impact your health. Shilajit is a resin-like substance derived from high-altitude mountains, formed from plant and mineral decomposition over thousands of years. This unique compound has shown promise in improving a range of health issues. First off, Shilajit is believed to have benefits for conditions like Alzheimer's disease. According to a 2012 study, an antioxidant in Shilajit called fulvic acid may help inhibit the buildup of tau protein, a marker of Alzheimer's. Another study noted that participants using a combination of Shilajit and B vitamins experienced less cognitive decline over 24 weeks compared to a placebo group. However, researchers stress that more studies are essential to confirm these findings, cautioning against premature conclusions. Next, let's talk about fertility. A 2010 study found that infertile men who took Shilajit saw significant increases in sperm count and motility after just 90 days of supplementation. It's a noteworthy finding for those facing challenges in this area. Shilajit may also help with high cholesterol. Research involving 30 individuals found that those taking Shilajit experienced significant improvements in cholesterol and triglyceride levels after 45 days. Additionally, an animal study pointed to Shilajit's potential to reduce liver damage linked to non-alcoholic fatty liver disease, although human studies are still needed for confirmation. What about altitude sickness? People may turn to Shilajit to ease symptoms like insomnia and nausea at high altitudes. It's believed to aid in providing oxygen to muscle tissues, which could lessen altitude sickness symptoms, but it is not a cure. Collagen synthesis is another area where Shilajit shows promise. This vital protein is crucial for maintaining healthy skin, joints, and bones as we age. A recent study indicated that daily supplementation with Shilajit increased collagen synthesis, which could be beneficial for overall health. Now, let's address bone health. For postmenopausal women, bone loss can be a major concern. A study found that Shilajit supplementation helped reduce bone loss and inflammation in women with osteopenia. It's potentially a good option for those looking to maintain bone density. Shilajit may also offer benefits related to iron deficiency anemia since it naturally contains iron depending on its source. However, the specific iron content in supplements can vary, so consulting a healthcare professional is recommended before using Shilajit for anemia. What about muscle strength? Research shows that Shilajit might enhance muscle strength in men participating in a controlled study. Those receiving higher doses retained more muscle strength after 8 weeks compared to those on lower doses or placebo. Though promising, further research is needed to solidify Shilajit's role in muscle health. Lastly, in the lab, Shilajit has demonstrated antiviral properties, potentially inactivating various viruses. However, these lab findings are a far cry from decisive human studies proving its efficacy. As with any supplement, it's vital to consult your healthcare provider before adding Shilajit to your routine, especially considering the lack of regulation in the supplement industry. Remember, while Shilajit has many potential benefits, further research is necessary to fully understand its effectiveness and safety. Stay tuned for our next segment where we will discuss the side effects and safety of Shilajit. Before we dive into how to use Shilajit, let's talk about some crucial precautions regarding its use. It's important to note that pregnant or breastfeeding individuals and children should avoid Shilajit in any form. If you have conditions like hemochromatosis or testosterone concerns, it's best to steer clear as well. Always consult with a healthcare provider to discuss any potential interactions with medications or other supplements. Now, let's get into the dosage. How much Shilajit should you take? The key takeaway here is to discuss it with your healthcare provider before starting any supplement. There's no universally accepted dose for Shilajit since research is still catching up. Studies have varied widely in the amounts used, and participants in those studies were generally under medical supervision. This means that more research is needed to determine the dosages suitable for specific health needs. Next, let's explore where you can find Shilajit and how to use it effectively. Shilajit is available in various forms, including gummies, capsules, powders, and liquid resin. While it commonly appears black, it can come in different colors and is known for its strong odor. If you're trying the resin, be prepared for a unique taste. You might find it more palatable when mixed with honey or stirred into warm beverages like tea or milk. Each product may contain different amounts of Shilajit, sometimes paired with other nutrients, so it's essential to adhere to the dosing guidelines on your product's label. However, a word of caution: some supplements may be contaminated with harmful substances like heavy metals. Even those labeled as purified could still harbor contaminants. Currently, there's no scientific consensus on which form of Shilajit is superior. Also, keep in mind that it's illegal for companies to market dietary supplements as treatments for specific ailments. It's crucial to remain informed and skeptical about such claims. In summary, Shilajit is a mineral-rich resin lauded in Ayurvedic medicine for various potential health benefits. Preliminary studies suggest it might help with conditions like mild Alzheimer's disease, high cholesterol, and altitude sickness. However, these claims are still under investigation, and more clinical trials are needed to understand its effects and appropriate dosages better. While the research is still evolving, some possible side effects have been noted, such as increased iron levels and hormone changes. Remember, like many supplements, Shilajit isn't regulated by the FDA, making it all the more important to consult your healthcare provider if you're considering using it for health purposes. Thank you for tuning in. If you found this information useful, please consider subscribing for more health insights. And as always, prioritize your well-being and stay informed.